Good morning, everybody, and thank you for having me here today. It's really a pleasure, and this is probably one of the best parts of my job, is getting to go out into the field, see what's actually happening in the Medical Reserve Corps. I'm stationed in the D.C. area, but I try to get out of there as much as possible to really see what's happening on the ground. So thank you for having me. And this is a great event to come to see all the Medical Reserve Corps volunteers doing what you do best, which is helping your community. I also want to thank Alvin for accommodating us today for the filming that we're doing. We are hoping to have some greater awareness and recognition for the MRC through the filming that's being done. So thank you for agreeing to do this today. It is a pleasure to be here amongst my wonderful colleagues. As many of you know, the MRC got started in 2002 following the events on 9/11, following the anthrax attacks that came right after that. So we're rapidly approaching our 10th year. And what an incredible 10 years it has been. And phenomenal growth that the MRC has had as a network, from 0 in 2002, 0 volunteers, 0 units, to 968 MRC units around the country now, all 50 states, several of the territories, and little over 200,000 volunteers. Volunteers like all of you that are helping in their communities day to day, helping to expand those capabilities of their communities to meet those needs, saving lives, preventing diseases and injuries through things like immunization clinics, but also through health education, through screening, empowering people to act within their communities, providing services for oftentimes those who are most in need, so eliminating health disparities, helping to reduce vulnerabilities, improving preparedness for emergencies by doing training and drills and exercises like this, building resilience within your communities by building your social cohesiveness, that connection between each other, but also that connection between you as volunteers and your communities. Responding when needed. As we've heard, there have been a lot of opportunities to respond this past year here in New England, but also across the nation for tornadoes, for hurricanes, had our small earthquake down in the D.C. area. But again, the MRCs are ready and can be counted upon, as they are needed. There are a lot of keys to the success of the MRC. The local focus, I think, is one of them. Having local volunteers ready, willing, and able to meet those local needs when they come up. The planning that is done, training like this, planning exercises. Partnerships are absolutely key with hospitals and health systems, with governmental organizations like the emergency management agencies, EMS, fire, and law. Also with the non-governmental organizations like the Red Cross, or with student organizations like HOSA to get future health professionals involved. Getting the right leadership involved has been a key to success. Folks like Alan, folks like our state partners, both here in Massachusetts. We also have our Rhode Island partners here, Tom Lawrence and Aaron McDonough, coming to support the efforts that are here. That leadership and partnership are key. But then also, absolutely key to the success of the MRC is the dedication of all the volunteers to make this happen. So thank you very much.
I would now like to introduce Tom Lawrence from Rhode Island. He's not only you can explain all your titles as DMAT as well as, yes.
Well, thanks all for coming. I was really happy to hear that this was going on. I met Alvin several years ago, but most recently at a meeting in Connecticut, and he said he was doing this event, and I said, well, I'm coming. So we made the trip, the long trip over the bridge, and I'm really happy to be here to see y'all. As I was standing here thinking, my father was a Pearl Harbor survivor, and on this day, I kind of think of him, and I'm wondering to myself, how did I find myself in this spot at this time? And I have to give credit to him in the sense that he instilled a sense of volunteerism in me, which I've spread around like the plague. And we're very fortunate around. We have a lot of volunteers in our Medical Reserve Corps, and it's the volunteers that make this all work. It's not necessarily me. It's not the mayor. It's not the government. It's not even Captain Casada, who I love like a brother, or a son. But it's volunteers. It's people who will walk away from their jobs. As many of you, how many people took a day off from their job to come here and do this today? I'll bet a bunch of you, only me? No? And that's what makes the whole difference, is people are willing to do that. It amazes me every time, it humbles me, and I'm very proud and happy to be here today with, to support Alvin's effort and your, all of your effort. And also I have my great friend, Aaron McDonough, who's the MRC coordinator in Rhode Island. We only have one unit, but lots of members that were pretty active. Mayor, you may, where's the mayor? We're standing over here in the caged off area, and some guy was banging on this door, shaking the door. Aaron goes like, you have to go around. It was the mayor. It turned out he had a key after all. So again, what you all do is the greatest thing, and I'm more than happy to be here to try to help move that along. Thank you very much again.
Now I'd like to introduce Rick Aguiar, our Director of the Emergency Management Agency.
Thank you, Alvin. Good morning, everyone. I think when we look at this country, it was made on volunteers, made up of volunteers, and MRC is a great contribution to the volunteer group throughout the country. I've been in emergency management and firefighting for many, many years, so I know what it's like to have volunteers behind you. The fire department was started with volunteers, and that was a stepping stone way back when to become professional firefighters. And now with EMRC, I think this could be a professional group as well down the future. We all need help, and I'm very, very proud of the fact that Fall River Emergency Management has a great partnership with Alvin, with the Fall River MRC, and with Dr. Valancourt with the Health Department. Whenever we have a situation within Fall River, they call upon my group, who are volunteers as well, to lend assistance. There may be flu clinics or some situation that involves the MRC. We just had the hurricane most recently, and Irene came through, and we had to open up 2 shelters in Fall River. Well, I called the Red Cross, and the Red Cross they were out to capacity, and they could not come out to help us. So I called Alvin. He was away, like he always is, by the way. And then he told me to call Maggie. Then finally I spoke to Tammy from Somerset. And he said, Tammy, I need some volunteers to open up some shelters for me, to work in the shelters. Because the Fall River MRC has a great partnership with the American Red Cross. And that was part of Alvin's doing it as well. So, lo and behold, we had MRC volunteers to man our shelters, that worked in our shelters. And I don't know where I would have been as the Director of Emergency Management without the MRC people. So I applaud all of you for helping me, because it was a great help for me. I'm here today as well as the incident commander for this situation, because in the event, if it would be an actual incident, then we would have planning, logistics, we would have the security force in place, which we have now, but my volunteers are here. So we kind of, once again, when Alan called upon us, we're here to help him. We're here in a professional capacity, even though this is a drill, but in the event if we had to open this up as the actual flu clinic where we had many people, matter of fact, once, not too long back, I guess it was last year, we have opened up the Cuss Middle School, and we had over 800 people that came through. And we pushed 800 people through, believe it or not, within 2 hours, with the help of the MRC and the volunteers for emergency management. So we do work well together, and it's a great partnership. And I thank Alvin for having me work with him and Dr. Valancourt, because we all make a great team. Thank you very much.
Okay, in closing, I want to wish my appreciation to all our volunteers, our staff that have come here today, and all of our visitors, our special visitors, Captain Rob Tosado from the headquarters, and Grace Middleton that is with him, and some other special visitors that we have, Diane Brown-Kuchar from the State Massachusetts Department of Public Health. So I appreciate all of you coming, and now we're ready to get to work what we're here for, and that's to run a flu clinic and a drill. So thank you again for coming.